2023 will be seen as a technological catalyst that transforms humanity. Alongside ChatGPT taking the world by storm, here are some of my favorite moments that will go down in history. On March 10th, Silicon Valley Bank collapsed. Twitter was rebranded to X in July, and then we closed the year with the AI war getting a little bit heated and messy. And let's not forget Bitcoin's back on the rise.
I don't have any Bitcoin.
It's safe to say that 2023 was a whirlwind, and the tech landscape was even more exciting in the context of healthcare. On August 30th, the once valued $4 billion health tech titan Babylon saw its collapse, and the big tech giants like Microsoft and Google have all started talking about healthcare and want a seat at the dinner table. So what does 2024 have to offer? I'm joined with Dr Molly Gilmartin, a health tech investment manager at AlbionVC, who manage over $1 billion in assets. Molly, alongside AlbionVC, published the 2023 health tech market map, which includes some of the biggest European companies across digital pharma and digital care. In this episode, we discuss the health tech market trends to watch out for in 2024, and I begin this episode by asking Molly to break down some of her biggest learnings from 2023. Please subscribe to the channel, and I hope you enjoy.
In a hype period where everyone's really excited about an area, a lot of funding is thrown at the problem, and sometimes I think it can mean that some discipline might be lost a little bit. It's the same as personal finance. When budgets are tight, you're actually much more careful about where you're spending any money. And so I think the basis really is about unit economics. Break-even unit economics mean that it costs you less to deliver it than what people will pay for it. So on a unit basis, you're making some sort of profit. If you don't have that, you're never going to get to break-even business, right? Because you're going to have all your operational costs too. And I think whenever we look at some of the areas that were super hype areas during the pandemic, like teleconsultation, some of the digital therapeutics companies, what actually happened was when you look at how patients engage with these products, the unit economics just don't stack. So the cost of delivering the service, which that's the thing about healthcare that we have to remember, is often there is some degree of service in these businesses, cost more than what the patients are paying for it. So the kind of all-you-can-eat teleconsultation offerings can be quite tough. So I think there's discipline for startups to really at that early stage, not rush raising massive rounds until you're crystal clear that your unit economics are scalable. I think that is a really key learning. I think the second thing is being honest as to what is good scale in health tech. I think a lot of tech companies obviously raised big rounds, and some of that was then translated across to health tech. But to then reach the heights of growth you need in terms of valuation, if you're raising a huge round at a huge valuation, you have to think about what does your revenue have to grow to in order to grow into that valuation. And often that means you're going to have to scale a minimum of 2, 3, maybe more geographies. And I think some of the health tech solutions that are built within one geography, the first geography, the reimbursement mechanisms are different, the regulation landscape's different, so there's a complexity to health tech that maybe doesn't exist in sort of B2B software.
You mentioned some of that hype that we saw during the pandemic, whether it was with teleconsultations or digital therapeutics. What are some of the interesting trends that you noticed in the health tech landscape in 2023 that you expect to continue seeing in 2024?
So I think it's not going to be a surprise to anybody that AI has driven huge growth across both digital care and digital pharma. So the two segments in the market map that grew the most in terms of new companies being added to that segment were diagnostics and clinical decision support on the digital care side and AI drug discovery and tech bio on the digital pharma side. And I think that's not shocking. It is important to note that a lot of the companies that have entered that now are still early. So those points we were just making earlier about that scalability piece are going to be super important there. But I think we have seen such development in how AI is being applied across all industries. And I think in health tech, there's a particular excitement as to how much impact this can have in care delivery.
It was AlbionVC, they put out a statement in one of their reports where they said that AI drug discovery companies within this tech bio sphere grew over 100% in the last year. And I had a feeling you were going to mention AI. So do you think this hype is going to die down anytime soon? And what could cause this hype to die down?
I think where hype tends to die down is once the sort of excitement settles and the sort of real world applications of how this is being used come to fruition. Large language models, LLMs, the reason it's so exciting in health tech is we have so much data in healthcare, and we have most hospitals now have electronic health records, we have our personal health apps, our wellness apps, etc. There is fragmented data on a consumer level and on a provider level that sits there, and the ability for LLMs to take in that information and summarize it quickly and find insights from it is something that we haven't had before. The reason I think diagnostics and clinical decision support has had the growth it's had in new inventions is that actually once you've got all that information, suddenly the insights you can draw and the credibility of those insights and actionability of it is much higher. That said, often it is one step in the clinical workflow. And as a clinician yourself, you'll know that diagnostic piece or the co-pilot that can help a clinician identify certain insights from that they're looking at a patient. There is a challenge there as to how does it integrate into the workflow of clinicians who are really busy and time stretched and they have to get up to speed with new technology. And how does it integrate in workflows as you span across different health systems in different geographies or different disease indications. So, for example, there are some really cool companies out there that are doing amazing stuff around, for example, summarising medical notes or summarising dictation for clinicians. Huge time saving. But is it actually cash releasing in terms of its business case? So when you think about a business case for a product, you think about productivity savings as like the lowest business case. You're not actually reducing cost really, you're just making people more productive. The next level up is a cost saving that actually is cash releasing, so you can then spend that money elsewhere. These models are becoming much more accurate and much more sensitive and specific, but not enough that a patient and clinician are going to trust them to do it without the clinician in the loop. And also the human touch is super important for patients too. So I think what our challenge is that some of this tech is absolutely fantastic and super cool, but is the application leading to a business case that is going to release cost in the way that it can actually generate revenue for those businesses that helps it scale? So I think we've got a lot to get excited for with AI, but I think in healthcare, we always have to taper that with the concerns about safety, regulation, and scalability.
I guess there's always been talk of moving away from a traditional sick care model to more preventative health, and as part of that, we're seeing a rise in wearables focusing on longevity. Any insights on that?
I'm particularly bullish about where we take a specific disease area, the patient pathway, and actually innovate on the care paradigm along that. And that's where, if you look at the market map, you've got diagnostics and clinical decision support, you've got chronic care, you've got remote patient monitoring. Actually, what you start to see with some of these virtual care businesses is they're combining parts of all of those different segments, but doing it in a disease-specific way. And that's the bit I'm most excited about. And that will include some of the sort of more consumer-based facing things, so your wearables, etc. But integrating those into a pathway means that the insights are actionable. The risk sometimes with these point solutions is that patients get solution fatigue, and they're constantly promoted these different tools that are meant to transform things, but engagement in these tools is what allows the insights to be had. If you only wear your wearable once a week, it's not going to give you those insights. So where you can connect it through to where a patient sees how it is actually impacting their management, I think that's where it gets very exciting.
So sticking with trends, we're obviously seeing a rise in Bitcoin at the moment. And so do you think we're going to see some hype around Web3 technology as well in 2024?
I think we've already seen that in 2023. I think thinking about blockchain in general and how that allows for ownership of data, patients are get concerned about that. I think one of the challenges with all of this is really working out why there has to be a blockchain or a Bitcoin element to the product. I think sometimes it's a bit of a buzzword. So working out where it actually is a technology that can enable something that can't be enabled without it is really important. And that's the same with AI as well. It's like actually with these newer technologies, how are they doing something that hasn't been able to be done before? So how is tech actually enabling a new way of working? I think that's the laser focus that needs to be had whenever looking at any of these sort of new technologies.
And when talking about the future of healthcare, something that gets me quite excited is Moore's Law. And it describes a rule where effectively the price of compute power drops by half every year, right? And so as the price of something drop, I guess mass adoption does follow. But specifically when talking about healthcare's future, we do see that healthcare does lag behind other industries. Yeah. And to understand where technology in healthcare is going, it's sometimes good to look at other industries and to see where other industries have been disrupted. So what are some of the trends that we're starting to see in other industries that you think we will start seeing in healthcare in the next couple of years?
Yeah, I totally agree with that. And actually, I've done a bit of analysis on this when looking at different industries. So looking at kind of the digitization opportunities. So if you look at industries like advertising, it's become very digitized, financial services to a degree. Then you look at more retail, for example, actually more digitized than healthcare still, which we're not shocked at either. So it means that the opportunity for digitization is huge in health tech, in healthcare. And I think it's important when you're thinking about other industries and where we can learn from them to think about the problem they're solving and not necessarily just the solution they've built. For example, there's a company, again, in our Albion portfolio that was a B2B software investment on more of the sort of enterprise software side called Quantexa. So what it focuses on is entity resolution. The main use case they started out with for financial services was around anti-money laundering. So when doing the AML checks, how do you resolve the individual entity, i.e. the person, to work out, is there any risk with that individual? Now, if you think about that problem of entity resolution, that definitely exists in healthcare. We've got in lots of different health records, different versions of Ash and Molly. You've got the challenge that across those fragmented data sets, you've got duplication, for example. So on a lot of the elective waiting lists, there's a lot of duplication across that as well. And so that suddenly, an entity resolution problem can be solved with a software that's been built at scale in another industry. And Quantexa is doing that now. So I think there are places where we can lift and shift the solution if the problem is very similar. Obviously, one of the challenges in health tech is there are some problems that are very healthcare specific, and so being built within that industry is going to give it a unique advantage. If we use startups as a way to look at how different industries have scaled, I think the analysis that we did was that the number of European health tech unicorns is about 10% of the number of fintech unicorns in Europe. So it gives you an idea that actually there's a lot of opportunity in terms of companies to scale. And then if we look, some people might say, well, that's just because it's harder in healthcare. Yeah, it probably is. But if we look at the US, we've got about 15% of the number of unicorns as the US in Europe. So I think there's a lot of opportunity for digitization in healthcare, and therefore some of these companies to really scale and achieve the impact that their visions depict.
And just to quote another report from Albion, I'm going to read it out because I don't want to get it wrong. So they were talking a little bit about the problems that we find with healthcare adoption. And they said that most people in the industry would answer the question of why healthcare has been technology laggard by giving one of the following reasons. And it was that the industry is highly regulated, as we've mentioned. Providers are dealing with very sensitive information, and there are complex stakeholder dynamics. But then it also highlighted that the lightning fast adoption of technology across healthcare in the wake of the pandemic has shown that, in fact, the main problem has been inertia. And so just as we close the podcast, what are some of the other things that we need to watch out for in 2024 that could kill innovation?
I think one of the biggest ones is actually the engagement. So it's more than adoption, it's actually engagement, because the quality and volume of engagement is what helps with all of these insights. And that engagement needs to be for whoever the user is. So whether it's the patient engaging in a digital pharma clinical trial setting, whether it's a patient in their chronic care management, but also then the clinician. So the stakeholder management is important here that was mentioned, because actually it's about how then these different stakeholders are engaging with the tool, because that is what will enable the success of it. At the same time, it comes back to this point I made earlier of, and how does that engagement translate into a business case? I think that is really important to focus on, because unless that is clear, then the unit economics aren't going to stack, which we talked about at the beginning. And I think if you can get that sort of right at an early point, even at very small scale, small pilots of patients and engagement, but get it right and show the unit economics stack, then you're scaling something that has the potential to be super successful. One of the challenges is that the funding trajectory of some startups does not actually translate to the scalability of it. So if we are really disciplined as to what that looks like in the first instance, then we can fund it appropriately to scale it to the level it can be. But if we start to fund stuff and scale startups and solutions that actually aren't scalable yet, that's where then we lose confidence in these technologies. And I think we're now at a point where over 5 billion euros has been invested in the just less than 1,000 companies in the market map over the last 3 years. That's a lot of money. And so one of the things we need to make sure we do is actually deliver on some of that investment and show the efficiency that technology can bring in healthcare. And I think it could be really exciting. The age-old challenge in healthcare is, how do we deliver amazing care at an individual level, but allocate resources in a way that's cost-effective and efficient at a population level? It's an insurmountable challenge, isn't it? And you look at different health systems in the world, no one has properly solved that. But technology can help us do that, because suddenly we can start to allocate resources as to how patients need it and how they want to engage in it to the maximum, most successful way. So you get a flywheel happening where we're giving personalised healthcare based on the technology insights that we're getting. So we're not wasting money on things we don't need to do, but we're engaging with patients and giving interventions as they're required to ensure the best quality of life. So I think that's where I'm really excited about technology, is it's actually how we could solve the most fundamental and knottiest problem in healthcare. But obviously it is really challenging, and there are lots of things to consider as we go along that route.
And just to close, top prediction for 2024, Molly?
Oh, I think we're going to see some really new ways of how care is delivered on that basis. So if we can actually, along a disease area that is particularly in chronic conditions, which are the hardest to deliver cost effectively, we're going to see that technology really transforms that. We've already seen some of it, but I think we're going to see it at a larger scale. And any startups that are looking at innovating in that space, I'd be really excited to talk to you.